Hello. All right. This is Amy DeMarco. I'm with Molina. Looks like I'm going to be moving over here, sharing my screen. Derek, are you on? Did you want to kick us off, or should I just jump into our deck today? I will take that as we're just going to jump into it. So, thank you guys for joining today and being early and on time. I know we are a minute after, but there's a lot to cover. So I, want to make sure that I respect your time and that we can jump into this and get started. So a massive thank you to Derek with Broker's Broker for putting this together and getting you guys up to speed on all the craziness that has been going on the past couple of weeks after the American Rescue Plan was put forth and signed. And Andrea Espinosa is also on the call from Molina, and so she'll be hanging out. Andrea, if you can take a look at any questions and shout out if there's anything that pops up as we run through. I'm always happy to take questions as they come up. So don't hesitate to, type those in and interrupt. Quote unquote. I think everyone's going to be on mute throughout the presentation. So, feel free again to chat or, shoot over questions as they pop into your head, and we'll do our best to answer them throughout the training or definitely at the end. We should have some time afterwards to get to anything that hasn't been covered yet. All right, so my name is Amy DeMarco. I'm our Director of Sales for the Western region for Molina Marketplace, our ACA line of business. I cover the states of California, Texas, Utah, New Mexico, and Washington, and soon to be Idaho. We will be hopefully adding Idaho to our Western region in 2022, but stay tuned on how that filing goes. And here today to give you guys an update on the American Rescue Plan Act of 2021 and what it means for you and your members. Gotta get back here. Perfect. All right, quick agenda. We'll go over the American Rescue Plan, what it means for you guys, what we're doing to help prepare you guys to support this membership and make sure they can take full advantage of it, and a couple other things we're doing in-house to improve the member experience at Molina. Jumping into the rescue plan, almost a good $2 trillion, I should say, going into this. People were most excited about those stimulus checks, so hopefully you guys are getting those. The earned income tax credit, the child tax credit, all good things to help folks get through this difficult time, and a couple other, chunks of a few billion here and there for schools and testing and vaccines. So a lot of great stuff going on here, and it wasn't really making headlines, but the subsidies assistance for our ACA business and the impact that it has have been monumental. I mean, the biggest change to the Affordable Care Act since it was, passed, over 11 or almost 11 years ago now, right? So, big changes coming down the pike. The biggest ones here would be, the additional subsidies. So this is going to be impacting members for the current year and for 2022. After that, we'll see, what they do. It's going to be hard to roll these out and then, have people go back to the old way where they're paying more money for their premiums. So I imagine the administration is going to try and tackle that in a year or so. But as it stands right now, these subsidies, you should be able to see them currently on healthcare.gov to view the impact to your members, and you'll see them in coming weeks for Covered California and Washington Health Plan Finder. But the really big buckets that we're looking at here, the most impacted will be those 100 to 150% of the federal poverty level who are currently paying 2 to 4% and change of their income. They'll have a $0 plan in FFM states, a $1 plan in California and Washington. 150 to 200, again, massively reduced out-of-pocket costs for their premiums here, 0 to 2% from 4 to 6.5% where they currently sit. And I won't go into every other line item here, but the other big impact that we're looking at is the kind of moving away from that subsidy cliff that we've seen in all of our FFM states, and only was recently kind of addressed by California with the state subsidies. So anyone who is above 400% of the federal poverty level will only have to pay 8.5% of their income towards their premiums. And that is tied to the second lowest cost silver plan, the benchmark plan. So if they buy the most expensive plan on the market, it's not like tied to that, but the silver, with silver loading, those silver premiums are still pretty high. So those subsidies are going to be tied to those, silver loaded plans. So they'll be seeing some good rebates on their taxes for any months that they don't opt in currently for 2021. But if they say they opt in May or April for effective May 1st, then when they file their taxes, they can take advantage of those additional increased subsidies from January through April. And I'm getting ahead of myself here because I know I have all these dates on my future slides. So and we will be sharing this deck, so you guys don't have to take notes, but feel free, take screenshots all you want. This information came from the Kaiser Family Foundation site, but I also stole the Covered California chart here. I just like to it gives a different perspective, but it kind of shows in stark contrast where we currently sit, and with California, state subsidies maxing out for 600% FPL at 18% of income. This is that plateau where no one is going to be paying more than 8.5% of income, of their household income for their premiums. So very excited to see that. I think that's going to bring a lot of people back to the market who were previously priced out and didn't find it affordable for them. I mean, 8.5 is still a little pricey, but it's definitely a big drop from that 9.83% that is currently where they deem affordability as a percentage of your household income for these premiums. And we did get an updated federal poverty chart. So, it's not too different. This comes out every year in, March or April. And so it's just a little bit of an increase for each one of these tiers. So I like to call this out because if your membership was, say at $17,500 for an individual, they really would have just been above the Medi-Cal threshold. But now with this automatic redetermination going on in California and Washington, if they don't go in and change their income, they will be automatically deemed eligible for Medi-Cal, which I know is never fun. So if you guys have anyone who's kind of on that cusp, definitely recommend going in and working with them to get that updated so that they can continue on with the coverage that's right for them. And, I know a lot of folks can, guesstimate what their income is going to be for the year. And if it's a little bit higher than that Medi-Cal threshold, that needs to get updated so it can make sure that they're not pulled into Medi-Cal when the redetermination goes through. And I have the dates here. Nope, not here. Next slide. But the dates we'll cover in a second. What does this mean for consumers? I touched on the fact that, these subsidies are going to be in place for 2021, 2022, and then we'll see what happens. This does impact just on exchange membership. And there was just one change for 2020, for those tax reconciliation for any subsidies received. So this isn't going to impact a 2021 or 2022 tax filing, but for those folks who were on a plan in 2020 and who paid who received subsidies maybe more than they were eligible for because it was a crazy year, they didn't know how much they were going to make, they underestimated. If they underestimated and end up getting more subsidies than they would have, once they updated their income, would have been eligible for, they will not have to pay those back. If they have already filed their tax return and paid those back, recommend talking to a tax preparer and filing an amendment so that they can, get those paid back to them, then get that recouped. So again, I'm not a tax professional. I do want to add that as a caveat. So, and this is kind of being implemented and interpreted as we speak. So things are changing constantly. This deck is current as to the best of my knowledge as of today. Sorry, my dog is in the room. This is changing constantly. So please, if there are questions about taxes and what this means, and, we have a lot of questions from group folks who are still trying to determine what this means for them. A lot of this is still being figured out, especially by the IRS when it comes to some of these things that are going to be, recouped on taxes. So stay tuned for future updates on that. But as it stands right now, these folks should not have to be paying back those additional subsidies for 2020. And unemployed individuals. This is going to be a big bucket of folks who possibly were not eligible for subsidies before, or based on income, or maybe they had employer-sponsored coverage and are now on unemployment and looking to pick up coverage. And this is going to make it extremely affordable for them. And it really is not dependent on their current income. So if a member is eligible for or received unemployment benefits for at least 1 week of 2021, they will be eligible for basically a $0 or $1 plan in their state. And, the FFM is still working on this. They're trying to implement this by mid-July. Washington Health Plan Finder has committed to implementing it by mid-May. California, I still haven't seen a finalized date on this specifically, so stay tuned, but I know they were trying to get it done as quickly as possible so folks can, take advantage of these additional subsidies. The sooner the better. They want as many folks signing up for these, $0 or $1 silver plans, or they could, technically get most bronze plans at that same rate based on this new income determination, which is putting them in the FFM states at 133% of FPL. And for, California and Washington, who have expanded Medicaid, they are making sure it's just 0.1% above the federal poverty level for for Medicaid and Medi-Cal here. So it's 138.1%. And that way, they're not going to be pushed into Medi-Cal or Medicaid by mistake. And, there was a CMS call this week that did say, these folks should not be going to Medi-Cal. This income determination is just for ACA. So, if they were going to be pulled into Medi-Cal, Medi-Cal would look at all of their income. This is just to ensure that they can get the lowest cost plan on exchange. So don't worry too much about them getting pulled into Medicaid. This really is just to target them for ACA business only. And then COBRA, not really a factor for your ACA members, but I do like to call it out just because we get a lot of questions about it. There is going to be temporary COBRA premium assistance for members who would otherwise be eligible for COBRA or falling into COBRA during the period of April 1st through no later than September 30th. And their employer would cover the premiums, then the employer is going to be getting that recouped, those premiums paid recouped as like a tax credit when they file their taxes for 2021 and 2022. At least that's what I've heard so far. So bottom line is the member won't have to pay the premiums, the employer will, and then they'll figure it out on the back end how to get repaid for that. So it's again just a temporary measure for 6 months. And then, I think the hope is that once these members maybe can't afford COBRA after this happens, they'll be able to jump on to the exchange. And if they're still receiving any unemployment benefits for 2021, they would be eligible for that, $0 or $1 premium referenced above. All right, what does this mean for you guys? I know we've touched on a lot of that, but here are kind of the biggest dates that that as they currently stand. We did just get, a big update from Washington this week, and an extension to the SEP period. So those are, reflected here, but I do just want to, make sure everyone's aware there's a little different timeline for each of the states that we're talking about, or the exchanges. So healthcare.gov, shop and compare with the new subsidy should have been available yesterday, and members can opt into those. So they'll be effective May 1st. Covered California is going live with their updated shop and compare tool on the 12th of this month, again to be effective May 1st. Wabi is taking a little bit more time to implement this, but just, basically a month after everyone else, visible on their shop and compare. The Washington, Health Plan Finder on May 6th, effective as early as June 1st. And SEP periods. Covered California is going whole hog on this SEP period. So we, had special SEP from 2/1 to 5/15, and then there was kind of this new open enrollment period opened on top of that. So from April 12th through the end of the year, basically December 15th, folks will have the opportunity to enroll newly eligible members, change plans, all that fun stuff through the rest of the year in California. In healthcare.gov, they'll be able to newly enroll and change plans, from the beginning of this SEP period through now August 15th. Wabi's a little different. You can newly enroll through August 15th as well, but the only plan changes they're technically allowing are within carriers, or if it is a true standalone SEP, where a member would otherwise be eligible for an SEP plan switch, they're honoring those as well. So, I know it's a lot. It's a little different in each state. So if you guys, want more details about that state-specific implementation or what healthcare.gov is doing, please don't hesitate to reach out. Happy to, get you guys more facts or fact sheets and FAQs on each of your markets individually. Another, slight difference that everyone's going to be doing is how they will enable members to opt in or, automatically opt them into these subsidies. So healthcare.gov is, as it stands right now, not going to be opting everyone in automatically. Members will need to go into their account, select that they do want to, take advantage of these additional subsidies. And basically every member will have to touch their account or broker. You'll have to assist them with opting into these subsidies, throughout the rest of the year. They can opt in at any time. But again, plan switches, if they do say, hey, I'm on a $0 bronze plan, I want to take advantage of maybe, a $0 or $1 silver plan, they will have to do that for healthcare.gov and Wabi by 8/15. So keep that deadline in mind for anyone who might want to take advantage of these increased subsidies. So any of your, silver 94 in California or silver 100 in Washington and the FFM states, those folks, if they're on a bronze plan right now and they're paying, nothing, then this won't impact them. But if they do want to jump onto that, silver 94 or silver 100 plan for, again, the same price, it'll either be, a $0 or a $1 plan. If they're in that 100 to 150 FPL, they can do that throughout this SEP period. So I will talk about how you can target those members based on your Molina book of business in a minute, but that's another fantastic opportunity for you guys to assist your members with getting the richer plan and making the most of these subsidies. Okay, and Covered California and Washington Health Plan Finder will automatically opt-in members for these subsidies, so that will take a little bit of load off your plate in those states. California is going to do that the second half of this month, between the 15th and the 30th. Washington is going to do it. They haven't given a firm start date, but they said it will happen by the 15th of May. But members will be notified in April if there's any reason why they're not going to be automatically opted in. If they maybe need to update their IRS eligibility to check their income or something like that. And as I mentioned, they can opt in any point throughout the year, and they will be reconciled for the entire year. So if they don't opt in and they were eligible and they file their taxes and it says, hey, you technically, if they were paying premiums and they could have had those covered, they can get those dollars recouped on a tax rebate, tax refund. All right, examples of the new subsidies, another chart for you guys, just another visual on how this will impact your membership by FPL level. So 149%, they would have been paying 62 for a silver plan. Now they'll pay 0 or $1 in California and Washington. And then, it goes up from there. So pretty significant changes. This, especially during a difficult financial time like this, we hope that this will make a big impact on members, and we'll see them stay on the exchange and move on to the exchange to take advantage of all of this assistance. And I think I've touched on all these buckets, so I won't beat a dead horse, but these are the newly eligible population. So anyone over 400% of the federal poverty level, outside of California would not have had this assistance previously, and they now have that lowered benchmark of 8.5% that they'll have to pay towards that silver plan out of their annual household income. The unemployed getting, 0 or $1 plans now, and then of course the uninsured. We've heard throughout the year that folks left because things were just too expensive, and it's deciding between, basic necessities and having your health insurance. We know which, which will usually take precedence. So this will hopefully allow folks to be comfortable coming back onto the exchange and purchasing a plan this year. And who is eligible? So these are kind of the still remaining uninsured. Not, this would be folks who were not on the exchange previously and, are still out there in the market to bring onto the exchange. Maybe, in other states where there's not a requirement to get it, there obviously was no incentive. And now if they could get these additional dollars, we hope that they'll come back into the market. California, of course, has, a state mandate. But even then, we know there's still folks who the state mandate is cheaper than, the state penalty is cheaper than their premium. So they choose to pay the penalty. So hopefully that will no longer be the case and these premiums will be cheaper than that penalty that they would be required to pay. And, this is uninsured, newly eligible for the tax credits. And then those who are in these lower FPL threshold that would be eligible for the $0 or the $1 plan. So big opportunities there. And then, nationally, we're just focusing on Molina states because that's all we care about. But I know you guys sell in more states than just where we're located. So, this is 1.7 in our state, 1.7 million eligible for the new subsidies that are currently uninsured. And then nationally uninsured eligible for these tax credits would be 3.6 million. So, and I know these are usually understated because it's hard to get a full grasp on how many people are uninsured. So I think there's even more potential out there based on what we're seeing here. And a couple other questions I got, that I do like to address. This is, again, only for on-exchange members. So if they're off exchange and they want to take advantage of these subsidies, they do have to move to an on-exchange plan. I know we don't sell any off-exchange business, so we're kind of in the clear on this, but the other carriers are going to be needing to move, or really being highly encouraged to move that off-exchange business that's eligible for these subsidies to an on-exchange plan so they can, receive that premium assistance. Oh, and this has an old date. It used to be the SCP deadline of 5/15, but now it's 8/15. So members, still have until 8/15, August 15th, to get on exchange to be eligible for these subsidies. And that when they move on exchange, that will be on a go-forward basis that they're eligible for the subsidies. And the family glitch, what about making this affordable for folks, who are technically offered dependent coverage, but without financial assistance from the employer? This law does not address that. These members are still held to that same affordability guideline. So, it has to be, the only way they would be eligible for subsidies is if the employee only portion of the coverage was more than 9.78% of their household income, which usually the employee only portion is less than that. So then their dependents don't qualify for subsidies and don't get assistance from the employer. So, that's still something that the Biden administration will have to address as we move forward. So stay tuned. Hopefully we can see some movement on that in the future. And then agents of record, what goes on? What happens to you guys as the broker of record on these policies? You will remain the broker of record unless a member makes an active change. The exchanges have committed to ensuring that any feeds that come over with this additional subsidy information will contain a broker of record attribute so that we can make sure that you guys stay whole and none of these changes are impacting you guys from a commission standpoint or a business standpoint. And of course, there's with any change to the exchange, there's possibility for things to go a little awry. Sometimes the feeds are not perfect, but if there's anything missing, highly recommend that you send us a reconciliation form over to our commissions team, and I'll share the contact information for them in just a minute, so you guys can make sure that all commissions are paid. We want you guys to get paid on all your policies. Please believe us. It's just sometimes the technology doesn't always work in our favor. All right, Molina Sales. We have marketing materials now available on our FedEx site. The link is now available on our molinamarketplace.com website. We're going to be having some EDE trainings for our FFM states where we can talk about, how to assist your members going through your Health Sherpa portal if you use them. And we're also working on an updated broker portal to be rolled out this year. Fingers crossed. We have to get, all the approvals and sign-offs from all the different departments to make this happen. But our goal is to make you guys able to have access to PCP change functionality, ID card ordering, reports, automated, push notifications, things to help you access, okay, who's falling into grace period, who's behind on premiums, who's losing APTC. We want to give you guys as much visibility into your book of business as possible. So working on all this good stuff, as well as a new SEP bonus. So we have this SEP bonus currently in place for business that is effective 3/1 through 6/1. We're looking into seeing if we can get this extended or if you roll out, another bonus. So stay tuned. But as it stands right now, our current SEP bonus, so for members who enroll through the end of May, if you enroll 25 or more members, you get $50 per member enrolled, and that is member, not policy. So hopefully with all this new membership coming on board, that $25 member benchmark isn't going to be too hard to meet. And how do you figure out how to, support your current membership that might be eligible for these subsidies? So you can go into your Molina book of business, pull your business from, a 1/1 effective date. It'll also have some of your term policies. So if you want to reach out to them and, see if they fell off the books for financial reasons, if they're wanting to come back on, if they're on unemployment and can really take advantage of those $0 plans, highly recommend reaching out to them. And you can identify which of your bronze members might be able to take advantage of that $0 or $1 silver plan as well by pulling this book. You'll have to export it into a CSV or an Excel, and then you can pull out your bronze members by filtering product name, and then sort by member portion, which is the member portion of the premium that they're paying. So sort by smallest to largest, and you'll get your $1, $0 bronze members. And recommend starting there and then moving up because the higher their premium is now, the less impact they're going to be having. But it is still a big dollar impact even for those higher premium members. This could be a game changer for them. So if you need any support in getting into your broker portal or accessing this book of business functionality, let me or Andrea know. Happy to walk you through this so you can access your portal and book of business. And our broker services team is here to help you guys as well. So obviously you have your marketplace sales manager with Andrea and me, director of sales, but we have a whole crew in Utah who are dedicated to helping you with a litany of things. As you can see here, I specifically like to call out our care team because they are the best in the business with helping with member issues. We had quite a large influx of membership this year. We overshot our enrollment goal by like 100,000 in Texas alone. So, our internal teams were not really currently staffed up to support this influx. And on an average year, we receive 20 to 30,000 calls to the BSU. And that's a year. By mid-February of 2021, we had received 10,000 calls already to the broker support unit. So apologies if in the beginning of the year you guys were experiencing some longer than normal wait times at the BSU. It was just we were not prepared for this level of call volume. But we did just hire 4 new folks. Well, we hired them last month. They started last week or 2 ago. And then we are also in the process of hiring 2 new positions. So a total of 6 new people dedicated to marketplace only. And that is basically almost a 50% increase for our marketplace only dedicated staff. We have a couple of staff who do both Medicare and marketplace, but building out our marketplace staff as we speak, just to support our brokers like you. And they are in Utah, so it's in Mountain Time, but they're 7 a.m. to 6 p.m. Mountain, so 6 a.m. to 5 p.m. Pacific. And commissions, definitely reach out to them. Contracting, if you want to get contracted in any of our other states, Derek, Broker's Broker, can help you do that. But our contracting team can also assist you with that process as well, because if there's any time to start looking into some new markets, this is it. There's going to be, more folks coming on exchange than I think we've seen since, the first couple of years of the ACA. So definitely want to make sure you're prepared. All your licenses are up to date. The other good thing we're working on right now is to not require you guys to have an E&O up to date every year. So that's going to be a change in our contracts for the coming year, but we're moving away from that process right now. So if we, sorry, in the past, if we hounded you for your current E&O constantly, we will not be doing that moving forward. So we heard you guys loud and clear. That was not necessary. So moving in the right direction there. And if you're still in any of our other states, I know we've got Andre here. She's in California with me, but if there's anyone else you guys or anywhere else you would like support, happy to connect you to your marketplace sales manager in that region. And some operational updates. So talked a lot about the American Rescue Plan. Happy to keep talking about that, but I do want to hit on a couple other notes about what we're doing at Molina to make your lives better and make our lives better. One of those transitions that we're going through, we're in the final stages right now of our move to HPS, Health Plan Services, to support our enrollment and premium billing for all of our marketplace business. Our other lines of business won't be impacted, but this is going to be a massive, revamp for our Molina Marketplace plans. So, we've been handling enrollment and billing in-house since the inception of the line of business. And, it's just, as we've learned this year, it's not scalable, and we do, see more membership than we had originally forecasted. And with HPS, we will be able to scale up as quickly as needed if we see a change in membership the way we did this year. So HPS currently supports 21% of the market share for on-exchange business, assisting with their enrollment and premium billing. I think with our 600 plus 1,000 members, we're going to see that number jump up a little bit more for them. But it's going to be, a big improvement for us and from our member services point of view. So currently, all of these enrollment and premium billing calls come into member services because, all of our enrollment premium billing is handled in-house. Moving as of April 26th, moving to HPS, all of those calls will be directed to HPS to support. So we're going to see, over a third of a reduction in calls to our member services, which just means the current staff that we have at member services will stay the same. We'll just be supporting, a third less of these calls. So less wait times from a member services standpoint for Molina, and, a larger army of folks to support us in helping with these enrollment and premium billing issues. And so we're doing the cutover April 15th. There's going to be a bit of a transition period where we're uploading all that fun data and getting it into the system with HPS. We're still going to be processing enrollments, processing payments with Molina until we cut over on April 26th. And when we do that, then, the Pay Now button on Covered California, FFM Washington will go to HPS, as will all these member calls. So that's going to be happening. Unfortunately, we were planning on doing it when everything was slow during SEP. Biden had other plans. So I know we're going to be getting some of the updated files from Covered California, possibly Washington. I think Washington might be, after our go live deadline, which is good. But, any members who are opting in during this period, they will, of course, have those changes honored. But it might just be maybe a week or two before it's reflected appropriately in the system as we do this cutover, if they're making changes between April 14th and April 26th. So bear with us. We're doing this to improve everyone's lives. It's just the timing, unfortunately, worked out to coincide with the implementation of the American Rescue Plan. And other question I get on this is, what about your auto pay members? Nothing will change with them. They'll still be on auto pay. They won't have to do anything new. Everything will move over. If they don't have an email address on file currently, we are reaching out to them to get that, so we can ensure that we're communicating with them properly. And any auto pay deductions are being emailed to them every month, so we have that line of communication with them. But they should be, getting all that stuff. They should have gotten some robocalls or letters already, letting them know if they are falling into that bucket. And another fun thing we're working on, this one is a little earlier in the implementation stages, but we plan to go live no later than September 1st is our target date for our new provider directory. So we're going through a lot of vetting and decisions right now on how this is going to look and feel for us, what search functionality is there. So if you guys have any feedback on what, search functionality you want to see available on our future pod, please let me know. I won't name any other carrier names, but this is a very trusted partner for several of the large insurers in the on-exchange market, but also, group and off-exchange. So this pod might look familiar to you if you've worked with some of those carriers, but really they are, best in the business. This is their, bread and butter. They live and breathe provider directories. We've housed our provider directory internally for, I don't know, almost 20 years. And, I think it was great when it first rolled out, but it's kind of been the same platform since then. And, this is well overdue. And the other good thing about moving to this provider directory as well as HPS is that currently all these systems sit on our server. And so if there's slowness in our, if we have a lot of people searching our provider search or a lot of people trying to make a payment at the same time, or technically when we do our auto pay run, that slows things down right now. So having all of these, vendors come in and housing this functionality on their servers will widen up bandwidth for all of our other functionality for Molina, for your Molina Marketplace site, for our internal systems, our CRM, provider selection, all that fun stuff is going to be much faster once we can implement these functionalities with these new vendors. And speaking of provider selection, one of the cool things I really like about this new pod is that, with the single sign-on functionality, members will be able to change PCPs on the pod itself. So if they're shopping for their doctor, they're like, hey, this one has a lot of good reviews, I want to go with them. Oh, assign as my PCP, check it, and they're done. So they don't have to go into the My Molina portal or call their broker to make that change. Should be much easier than the current functionality now. And I mentioned the reviews. This is kind of a Yelp-like feature where members can go on and rate these doctors, which I don't go to a restaurant without checking Yelp, right? So I appreciate when I can see reviews from my peers on how these doctors have treated them, or wait times, or any other issues that they might have. And the other big point I didn't mention, but I like to call out, is that it's a Google-like search. So where you see that search that says family medicine there, you can type in anything into that bar, last name, a city, misspelled enteronologist, the ENT doctor, I still can't say enteronologist, but if you type that in there, they should get, anything related to that search, or similar spelling. And our MolinaMarketplace.com. So this one has rolled out already. We're very excited about it. Technically, we won an award, so people in our ops team are love to share that note. But it's a definite improvement off of what we had before, and we put a lot of thought into how can this be more intuitive for our members and more useful for you. And we combed through all the broker related stuff with a fine-tooth comb and made sure that it made sense for you and was up to date and current, and the links all worked and that fun stuff. So hopefully you guys have jumped on this website. You can access your benefits at a glance, summary benefits and coverage. Our marketing materials, as I mentioned, are available here, and banners. We're pushing out, the FAQs about the American Rescue Plan, additions to our network. We added a scripts banner for San Diego County now that we've added them to network. So it's just a lot more user-friendly tool and can help us better communicate with you and our members. All right, it looks like I'm ahead of time. I can't believe it. I usually, get bogged down in some of these details, but I tried to get through this as quickly as possible today. So I don't know, Andrea, are there any questions that have popped up? I can see if I can open the questions section.
But I don't see any questions on the chat.
Great, let me just. Awesome, okay, well.
Yeah.
Anything else you want to add, Andrea? We still got 20 minutes. I know this went by pretty quickly. Any?
I know, yeah, you did. But no, thank you all for joining us. Thank you for your time. And again, like Amy said, if you have any questions, please feel free to reach out to us. I'm available, and not just for questions about the American Rescue Plan, but anything. If you need PCP changes, if you have any issues with payments, my portal, anything like that, please feel free to reach out and I can assist you with that too.
Fantastic. Right. Well, and we did get trained. And we are basically member services folks now. We can do everything through our CRM system. So if there's anything that comes up, please let us know. And, this is an ever-changing landscape that we live in. And so if we get updates and new timelines or maybe a third extension of the SCP, we will keep you guys posted. And we will be putting it on our website, of course, but also sending out e-blasts to you guys. So thank you for your time today. I think we've got Derek on too. Derek, do you have any final
Yeah, I
off?
appreciate your time. Thank you guys for doing that. That was awesome, and it encapsulated, everything that I think agents need to know about this new rescue plan. I think it's a great opportunity for agents that haven't written as much ACA business that they, felt like they could have in the past. Given that there's this huge window of opportunity where, most agents have kind of closed their doors for the year. There's a ton of opportunity, especially in the federal marketplace states where those subsidies aren't being automatically applied. And also those folks that aren't even on a subsidy application. And I just want to drive that home to everyone, how extremely important it is that if you have anyone really in any range of the subsidy scale that, 300, 400, 500%, even more so if they're in an older age demographic, that you contact them just to evaluate their income situation and see if they're going to receive any benefit under the cap, because it's kind of a scenario where if they wait, they're going to miss out. And every month that they put that off is just more premium that they're handing over that could have been saved. So just take that into consideration for, like I said, especially your older generation in the, and I say older, I apologize, in the 50 to 64 bracket, where their premiums are truly in that unaffordable range, even though they are, making a decent income. They're going to benefit hugely from this. So keep that in mind as you go forward. And thank you, Amy, and thank you, Andrea, for both your time today. But I think we're good. I don't see any questions that popped up on mine either. So with that, I'll conclude the webinar. And just any questions you have in the future, reach out to myself or anybody at the team at Molina, and we'll help you guys out and get you going. So thanks again, and have a great day.
Thanks. Bye, everyone. Have a great weekend.
Bye. Thank you.